only earlier this week, another tragic story hit the news of a young woman who died after travelling to Turkey for a gastric sleeve operation. I saw this. It's horrible. If you or anyone you know is considering private, cosmetic or medical procedures or dental care, there are risks involved, whether that's abroad or in the UK, but there is advice and assistance available to help you make the safest possible choice. Dr. Ian Gargan joins us now from a not-for-profit that serves as a source of information on private healthcare, who can give us a few pointers. Good morning, Dr. Ian.
Good morning, Rima. How are you?
I'm really well. Thank you so much for being here, especially off the heels of this, like I say, this horrible story of this poor young woman who's died after travelling to Turkey. We hear a lot of people travelling to Turkey for different cosmetic procedures. What are your thoughts on it?
Yes, well, look, firstly, our deepest sympathies, and very, very sorry to hear about Morgan's death and the tragic circumstances. So our love goes out to her family and friends. We at the Private Healthcare Information Network, fin.org.uk, collect information about all of the private sector for the government across the UK to inform patients so that they can make a choice about where they go to get their care. So the information we collect are the nature of procedures that take place in particular hospitals, what facilities are available, what consultants work there, what their outcomes and what the quality of the work is there. And we collect information from over 600 sites across the country. In fact, we collected a lot of information from Leeds hospitals in relation to hips and cataracts, if anyone were thinking that are needed those procedures done. So fin.org.uk is provided by the government in the UK, and we're actually unusual. There's no other place in the world that has that information, and it's rare to be able to find that information from places that people may be travelling to, like Turkey, to have these cosmetic or dental or any other surgical intervention take place. And increasingly, as the waiting lists in the NHS, unfortunately, are increasing, people are turning towards the private sector. And because the private sector may be, for some procedures, be quite expensive, then people are looking to other places where it's less expensive, where they may be able to have the procedures they're having. Advertising is saying that, the procedures are much cheaper, which sometimes they are, sometimes they're not. People can go on to asa.org.uk to find out, because the advertising is not always completely accurate. And also they think they might be getting a bit of sun, Rima, so they're going somewhere where it's a bit more pleasant, having their operation and bringing it back. Now, but the information, so while they don't have a fin like we have here in the UK, each patient should be looking at that hospital and seeing what's their complaints procedure, who's the surgeon, does the surgeon have any reputation or have any statistics out there. But also be very mindful that there is a lot of people coming back. First of all, as well, we get our statistics from the Office of National Statistics, and it's saying that there are far less people going abroad than one would think. So it's a lot less than 1 million plus people that are going there. So the way a lot of people think comfort in numbers, a lot of people are going, so it must be okay. There are less people going than actually being quoted in the paper. So be very mindful of where you're going and what procedure is happening, but also what's the post. I was an orthopedic surgeon. Biggest part of the surgery for me is the rehabilitation and the care that a patient gets after the surgery. So what kind of care are they going to get afterwards? Are they going to have to return out there for further checkups? Or
how easy is it, Dr. Ian, to actually find this stuff out? Because really, what you're doing is you're putting your fate in the hands of someone across the world somewhere, and you can really do a bit of digging and a bit of research. But how much can you actually find out? And is it ever really safe to go abroad to get these procedures done?
So there are a number of brilliant pieces of information, like I've mentioned, in the UK, and we're leagues ahead. Why it's useful, even, Rima, to go onto fin.org.uk or even onto some of the NHS websites, is to actually see the kind of information you should be asking about.
Sure.
So that's the normal, that's what the sector says, how many adverse events are there in this surgery? What is the typical length of stay? What are the normal complications? What should a hospital have? What should a surgeon be qualified with if she or he are going to be carrying out this operation? So you gather that information here, then you use that information and you call the hospital you're going to, or you go onto the medical council, say, for that country in Turkey, or you look up and do some social media research and find out the same information as much as you can, even though there isn't one site for it, in that area. So, for instance, you're going to a Turkey hospital for, like, poor Morgan, you're having a sleeve gastrectomy and that kind of operation. Who does it? What's that surgeon's qualifications? Is there any feedback on social media from her or his patients about, like, how has it gone for them? Because especially you'll find that people in certain communities for certain type of cosmetic procedures, they have a very close social network on social media, and they give feedback and reviews about what kind of experience they've had in the hospital, what the staff were like, what the doctor was like. So, use the information that is at their fingertips at fin.org, and then go and ask for the same information at the site that you're going to have the operation.
I think that's all really good advice, because I think that there is an element of people thinking, oh, it'll be fine, because, those doctors should have the same, qualifications and everything as doctors here in the UK. All of that should be the same out there. It's just a bit cheaper. And there are people going out without doing their research, it's a really tricky place to be in, isn't it? Because people can make their own decisions, but it's, you're running the risk of something quite terrible happening.
Correct. Yeah, and in a foreign country and with systems that you don't know about. So I'd always say, and look, there's some. I trained abroad. There are some brilliant places, of course, abroad to train.
We should
fantastic
say that,
hospitals.
yeah.
So you can have certain countries that are known for various particular procedures and interventions have been a very high standard. So there's a lot to be gained, but also some very simple advice is, if you're going to go and do this, I would say, do your research, but also let some friends and family know that you're going and that you're thinking of doing this, and having constant contact, or even have a travel companion, because there's any risks involved in surgery. No matter how good the surgeon, there's always going to be a risk that things don't go correct. And one of the things you're always worried about as a surgeon is infection, or there's just some extra bleeding, or the wound doesn't heal quick enough. So you're going to need some recovery time before you fly back. And if you fly back very quickly, then you're in danger of, like, blood clots and things like that, DVT. So it is. Doctors and nurses train in different ways in different countries, and there's different ways in which they rate the quality of those doctors and nurses. So make yourself a bit familiar with that. Like if you're going to consume anything, especially if you're paying a large amount of money for something, you usually do your research for anything to make sure that the product is good and what you can expect in terms of follow-up. So you should show your body the absolutely same type of respect and insight.
Absolutely. Dr. Ian Gargan, thank you so much for being here and giving us this information. Really valuable, I think. Chief Exec of Fin, they're a not-for-profit that serves as a